I'm an orthopedic surgeon. I practiced for over 35 years, was chief of sports medicine at Emory University, chief of orthopedics at the Atlanta FAAOS. And I'm here to give you the full story on motion loss secondary to joint stiffness. Motion loss secondary to joint stiffness is the #1 complication in orthopedics, causing delay in your recovery. What is motion loss due to joint stiffness? It is the postoperative or post-injury scar tissue in and around the joint that limits your range of motion. Scar tissue is the result of bleeding in and around the joint. This bleeding causes overproduction of fibroblasts and extracellular proteins such as tensin C. These extracellular proteins are like glue in the soft tissue that hold the collagen fibers produced by the fibroblasts together. Treatment for motion loss due to joint stiffness begins with managing the issues in the extra-articular tissues around the joint. Fluid can collect in these tissues around the joint called edema. Edema can be managed using compression dressings or bandages which help move the fluid away from around the joint. The second step in the treatment of motion loss due to joint stiffness is managing issues that are inside the joint or in the interarticular space. Commonly, fluid can collect inside of the joint which will restrict your range of motion. This fluid is called an effusion. Your surgeon should look for causes of the effusion and help you manage this problem. The final and main treatment for motion loss due to joint stiffness is to stretch the joint. This process involves moving the joint along its normal lines of motion with a slow and determined effort to elongate the scar tissue, restricting your range of motion. Your physical therapist will help you understand the motions in which you need to stretch and train you on the stretching process. Your physical therapist will take the time to teach the stretches that you need to know in the directions that your joint needs to go.